this past spring and we limited the spread of the virus, we certainly are facing some new challenges as we prepare for the start of this new semester. But I want everyone to know we're committed to an in-person learning environment. Our students need it for their academics and for their mental health and well-being. I know there's still uncertainty out there, but we are confident that we can get through this semester successfully and safely together. We are fortunate to have our Carolina Together testing program fully operational, having now conducted over 200,000 tests to help keep our campus safe. And that team is very experienced and ready to work alongside us, our campus community over the next several months. We are requiring everyone on our campus to wear a mask indoors. That's been made very clear. We've not wavered on that. It was amplified and emphasized last Friday in our campus message. And we have been urging vaccination at every opportunity for months, and it's working. Requiring testing of students, faculty, and staff who are not vaccinated is non-negotiable. And we made that clear last week in our message as well. We don't, as I said in that message last week, we don't believe that we have to choose between safety and in-person learning. We can do both with the right approach. Our infectious disease public health experts, along with continued consultation with Orange County Health Department, have given us confidence that this is the right approach, and they support our plan moving forward. And I want to be clear, we have no intention of pivoting to a remote learning environment or sending our students home. We will keep evaluating the data and discussing it with our campus experts daily. We'll take all the necessary precautions, and we believe that we are ready. Having said this, we know that we will have positive cases, including some breakthrough cases in some of those individuals who are fully vaccinated. But with our strong vaccination rate and mandatory testing for those who are not, our experts and some of whom have joined us here today on this meeting, believe that we can navigate any spread of the virus and maintain our operations. Let me say a little bit about vaccinations and where we stand today. And these numbers are, came in last evening late, so these are as of yesterday. We will have a highly vaccinated campus community. Our attestation numbers are very good and improving daily. Right now, 84% of our students who will be living and learning here on campus this semester have attested that they are vaccinated. Only 3,200 have not yet attested, and they will be required unless they upload their information before the start of classes next Wednesday. They will have to be tested weekly. 64% of our staff and 92% of our faculty have now attested that they are vaccinated, and those numbers are also climbing daily. So anyone who does not attest or who has acknowledged that they will not be vaccinated will be tested weekly. A little bit about random audits. This process has begun. And currently, what we have learned is that over the past 2 weeks, we've shown a very high level of verification of the vaccine attestations. And we indicated last week that these verifications and audits were being done. And so we're really pleased with how that's going to this point, and that will continue weekly. Locally here in Orange County, 76% of the people living in Orange County are fully vaccinated, and 79% are partially vaccinated. And we were looking at the numbers earlier today. We may be the best county in the state. I think it fluctuates daily. There may be one or two that are of the smaller counties that have a better vaccination rate than Orange County, but clearly we're one of the top 2 or 3. Last year, we didn't anticipate the spread of the virus. And now we have a year of experience under our belt. We have a greater understanding of the virus. And we understand that there are some questions and concerns. And it's one of the reasons why we wanted to convene today. We've been listening and taking questions back to our experts. They've been answering questions for us and helping to guide us. Our experts have continued to emphasize that vaccinations, testing and masking will lead to a successful semester. And that's what has continued to give us confidence. So I'm going to stop there, turn it over to Provost Blouin to see if he wants to add anything that I may have missed before we open it up. Bob.
Yeah, well, thank you, Kevin. No, I think you did a great job of summarizing a lot of the work that has taken place to date. I think the classrooms are ready. I do just want to emphasize that we are going to have some flexibility, as we move forward through this semester, and we will be advising our deans and all of our chairs, to continue to bring compassion and flexibility to their decision making, and we are working with them to build out various scenarios in terms of what we might need to adapt to along the way. So a lot of people have been engaged in this to date, and we look forward to having this discussion today with all of you.
Great. So with that, I think I'll turn it over to our three co-chairs, Mimi Chapman, Lamar Richards, and Katie Musgrove, to see if you want to help guide conversation or if we just want to open it up.
Well, I think thank you both for starting us off. And I know we do have a number of experts joining us in various areas. As I understand it, what you all are looking for is a discussion of where we are and how people are thinking about the opening of the semester. So I think the best thing to do is just to start taking people's comments and questions. So who would like to start us off? Amanda.
Great. Thanks so much, Dr. Chapman. My name is Amanda Smithers. I'm a PhD candidate in the Department of Chemistry here at UNC and the Chief of Staff for the Graduate Professional Student Governments. So I have some big concerns, mainly the idea that we're going to do anything to avoid a shutdown, because that doesn't seem like you're putting the safety of our teaching assistants, staff, and faculty at the forefront, which I think is most essential in this process. I'm also concerned that, as you already mentioned, as the Chancellor already mentioned, there are breakthrough cases, but we don't have any plans to regularly test students who have been vaccinated to look for those breakthrough cases. As far as I know, I don't think students are being tested on arrival regardless of vaccine status, which I think is a huge misstep that we made last year that resulted in a large amount of cases that we didn't even know existed on day one. And I also am concerned that weekly testing, when we know a virus that can incubate and then happen quite quickly, isn't enough. I've seen other large public universities like Illinois at Urbana-Champaign had a lot of success doing twice weekly. And it seems that we have the infrastructure and ability to do that. And I think it would make us all feel a lot safer to know that we're doing the best we can as far as testing across the board.
Thanks, Amanda. I appreciate your questions. I'm going to turn to Dr. Barzun to talk a bit about reentry testing and the plan for testing those students who are not vaccinated. And then perhaps Dr. Weber or Dr. Pettifor, if you want to jump in on following that. Dr. Barzun, we're not hearing you.
I apologize. I got disconnected there. And Amanda, I caught the very front end of your comment. Do you mind repeating it for me?
Sure. So the big thing is we know that breakthrough cases happen. So I'm curious as to why we're not at least testing students upon arrival to make sure we catch those before they spread. And also that other institutions have had more success doing twice weekly testing. So I'm unclear why we're not doing that, at least for the unvaccinated individuals on our campus.
Sure. Yeah. So I think that you raise really great questions, and two that we've definitely looked at and that we are continue to evolve on. So as you may have seen throughout the testing program, last thing as possible, but to also change. One of the things that we want to do is start off with understanding just where we are as a group and as a community in terms of the volume of the tests that come through. So asymptomatic testing yield in those who are vaccinated compared to the amount of tests that you can get on a weekly basis to those that are 100% in our roadmap in the way that I've kind of mapped frequencies based off of the demand of what testing looks like, because we are still not sure how many.
Amir, we're having trouble. Amir, we're having trouble hearing you.
To
Amir.
have off. I'm sorry. Can you hear me
Maybe
a little
we
bit
could
better
come
now?
back to this when
Sure,
Amir's
sure.
in a better place to, speak, and we'll come back to Amanda's issues. Is that all right, Amanda? Richard, do you have a different
Oh,
issue?
yes. Thank you so much. I just want a better understanding, and this is for David, Audrey, and Amir. When we say, 70% have been vaccinated, we're talking about 70% of individuals who are eligible for vaccination in Orange County. Okay, that's what I thought. The next thing, do we know, the breakthrough cases? Where are we at as far as understanding when these breakthrough cases occur? Or these individuals who are 2 weeks out from receiving their second administration or their second dose? Or are they individuals who are experiencing waning immunity? And then my final question is, of the individuals who are, infected and they've had a secondary infection, do we know what that percentage is? How many of the cases are we seeing for the unvaccinated individuals are individuals who are experiencing a secondary infection?
So
Maybe-
I'll answer that question or start off. You asked multiple questions, so let me start off and say, first, the current vaccines are very effective and remain effective largely against Delta. There is some diminution of effectiveness against the Delta variant, dropping from 95% to, depending on the study, 70 to 85% for preventing symptomatic disease. But they remain very effective for preventing hospitalizations and deaths. You were considered fully vaccinated when you were 2 weeks after your either second dose of the Pfizer Moderna or 2 weeks after your single dose of the Johnson & Johnson vaccine. We do know that a single dose of the mRNA vaccines, the range of effectiveness was in the range of maybe 50 to 70%. It does drop dramatically against Delta to about 33%. So we clearly want people to have their second dose of vaccine to become fully protected. Roughly 10% of our hospital admissions now at UNC are in fully vaccinated people. But as you know, given the number of people in the state who are fully vaccinated, it does mean that 90% and the overwhelming number of people we see are first unvaccinated or fully vaccinated, but then immunocompromised, meaning organ transplant, chemotherapy. We know the vaccine doesn't work quite as well as against those people. We do know that you get a natural immunity after having had COVID, but it's not as good as vaccine. Getting vaccine, even if you've had COVID, boosts that immunity, decreases reinfections by 2.5-fold, recent paper by CDC, and that CDC explicitly recommends if you've had disease, as soon as you're past your infectious period, 10 days, you should get vaccinated. We do know that there is some waning of immunity after vaccine, but we have 6 months to a year's experience, and that there is a very tiny amount at this point in time of waning of immunity, which is why there is no current recommendation for a booster. Boosters are not allowed under the EUA, so I'm sure that would be a likely question. We can't give them, but the CDC has recommended to the FDA, and it's under consideration, providing a booster for those that are severely immunocompromised, again, organ transplant or chemotherapy, for instance, since it's safe in those individuals, does increase their immunity, and there is some evidence that it proves the vaccine effectiveness. And I would guess in the next 4 to 8 weeks, we will see a recommendation for those that subpopulation, which may include certainly some of our staff, much less likely the students given their age, but some students as well, And certainly the medical center is well equipped, as will Campus Health, to be providing those boosters. There is no vaccine shortage, in part because of, unfortunately, vaccine hesitancy and resistance. So even if we did recommend a booster for that group, I think that could be done in a very short period of time. I think I've answered all your questions, but I may have missed one in there. If I did, let me know, please.
Dr. Weber, I wanted to follow up with you on one thing, if I could, and that is, if I am fully vaccinated and I am wearing a mask, what are my chances of becoming infected?
So the primary, yes, there's no question, masks are highly effective in preventing disease. We have not had a single healthcare provider who takes care of COVID patients, many with Delta now, as I've told you, who has acquired COVID while wearing their personal protective equipment. So masks remain highly effective. I strongly believe in double masking, but by that I don't mean wearing two masks, one on top of another, although that does give a little better mask efficiency. But if everyone's masked, because we do know that the mask on the infected person largely prevents them from coughing out infectious particles, and then the mask on the uninfected person prevents you from inhaling those particles. So everyone being masked has a double layer of protection there, which is why I fully support the masking mandates indoors. And as you know, Orange County just changed their general recommendation yesterday.
And do you have to be wearing an N95 to assume that level of protection?
No, a properly fitted, so we wear N95s when we do aerosol generating procedures, but when we just do standard patient care, we're wearing a surgical mask. Some of those patients turn out to have COVID. We have not had healthcare providers develop COVID in those situations, and a properly worn, which was actually done by one of our faculty members here, William Bennett, in the EPA building, who's an aerosol engineer. Properly worn medical mask gives you excellent protection. There are some ways of improving the effectiveness just by the way you tie it on to give you a nice tight fit, but it gives you excellent protection, very close actually to an N95.
And David, if I could just jump in there for a quick second to just add something that's very important, because the comment of the number of cases over the past week, we have to remember we're walking into a different environment now, where now we have the county's support behind us for masking indoors, where it wasn't prevalent a few weeks ago. So we are going into a completely masked, not only inter-community, that's the university community, but directly impactful community of Chapel Hill and Orange County as well. So the masking is very important in this, and we cannot stress that enough, that is a great line of defense that we have on top of vaccinations.
And I do want to make the comment that testing is very important, but it's not a mitigation strategy. Masking and vaccines are a mitigation strategy. Testing is an early detection, and then quarantine or isolation strategy. It certainly plays an important role, but it's not a substitute for masking or vaccination.
Excuse me. Thank you, Mimi, and thank you, everybody. A couple of points, and just I'll speak for myself in saying that I do not feel safe. I do not feel safe. I am going to be begin teaching in about 10 days, partly in a clinical setting at the law school where I work in close proximity with my students. And I do not feel safe, although I have been vaccinated. As we just heard from Dr. Weber, testing will help reduce overall numbers, and it will very helpfully tell me if I have been exposed, but it's not going to prevent me from being exposed. What I'm particularly concerned about is the possibility of a breakthrough case of COVID and then long haul symptoms. That's partly informed by the fact that I've had family members who have had extreme long haul symptoms as a result of COVID infections. And I just read in the New York Times this morning that there is some indication that those infected may indeed have long haul symptoms. The other point that I want to make is I still don't understand why we don't have a mandatory vaccination policy. I have heard legal arguments, but none that are convincing.
Yeah, I think, Tom, I'd like to jump in and ask Jill if she would talk with us a little bit about the legal aspects of the vaccine at this point, because the system's explanation is simply, it's not accurate. So, Jill, are you around? Where are you?
Right here, I was having a little difficulty unmuting myself. Can you hear me?
Mm-hmm.
Okay. Well, first of all, I agree. I've read the legal arguments, and I don't. They don't make a lot of sense for me either. There have been different categories of arguments. There have been the constitutional arguments, which were well settled law in the 20th century and recently affirmed in the Indiana University case. And then there have also been arguments pertaining to the EUA, and there's been a lot that's come out about that has made those arguments seem less compelling. The main thing that has remained in North Carolina for the UNC system is the UNC system's directive that campuses can't adopt immunization requirements that haven't been mandated by the Commission for Public Health. And one of the documents I read referred to the commission as an obscure commission. I think that's probably fair. I think most people probably aren't aware of what it does, but it's something that I've studied for over 20 years. And so I just want to say this about the commission. The Commission for Public Health adopts immunization requirements for children. That's what the law that's cited in the systems memo says. The exact words are every child present in this state. So that commission's role and its practice for all these years has been to adopt the schedule of immunizations that kids have to have in order to attend childcare or K-12 school, with exceptions for kids who qualify for a medical or religious exemption. There is a separate law that requires students who attend private and public colleges and universities in North Carolina, equally applies to both, to show proof that they've received their childhood immunizations, those that are on the commission's schedule, unless they have a medical or religious exemption. But that is a separate law, and nothing in it says anything about the commission establishing the vaccination requirements for college students. It doesn't mention the commission at all. It's just about students having to prove that they received their childhood shots, measles and polio and so forth. So I do not understand how you get from there to the conclusion that universities can't require their students to get a vaccine until the commission puts it on the list of routine immunizations for kids. Can't find any argument that's persuasive on that. Those laws have never been interpreted in that way. In practice, I don't think we apply them that way. And in my opinion, it doesn't make sense to interpret or apply them that way now during a public health emergency. But we do have, and we're clearly treating it differently from our private peers as well. Duke University is subject to the same law. They've imposed a requirement. Same thing for Wake Forest, Elon, Johnson C. Smith, a number of other private institutions. So that is where we stand on that. Basically, I agree. I don't understand the legal arguments. I don't think they hold water, frankly.
Can I just make a quick comment though about this? So Duke is not turning students away that say that they do not want to get the vaccine. So vaccine mandate says that the students have to get it unless you have an exemption. Duke is still going to have a fairly substantial portion of their student population that is unvaccinated for religious or medical exemptions that are going to be tested on a regular basis. So I have to highlight the fact of what we started off with, the internal numbers that we've done. When we've had student attestation, and then faculty and staff have increased their attestations recently, given the memo. When you look at those numbers, it's probably a very close to similar number of campuses that are requiring mandatory vaccines. So I have to just kind of put the comment out there. I know that the word mandatory is really kind of a word that makes sense to a lot of us, but tipping the needle 1 or 2 percentage points in a high population of vaccination may not necessarily shift that much by a mandate. So I just want to highlight that there is a difference. I think that there's a misconception that if you're not vaccinated at those schools that are requiring vaccines or saying mandatory vaccines, that they are not going to be enrolled. Those students are enrolled and will be taking classes.
But they have to go through a process of receiving a medical or a religious exemption. So it's, I mean, it is a little different. And, you know, we're talking about mandatory vaccines for the entire campus, not just students. So, you know, I'm in my own role in my own school, you know, I am aware of students who are trying to, you know, 6 ways to Sunday, look for some way not to be vaccinated. So that's you know, it is an issue. And I mean, I am very heartened to hear Dr. Weber's comment that if I'm wearing my mask and I'm fully vaccinated, then my chances of having some sort of bad outcome or infection at all are very good. So, you know, I think I can personally feel pretty good in the classroom. But in terms of what happens on our campus and what happens to our health system, I still feel pretty worried. And I also feel worried about the timing. You know, it's one thing if we had another 3 weeks to get this in place, and then began all of the regular day-to-day in-person activities. But, you know, to be doing that while it's September 15th, before people even have to fully attest or begin their testing, but for faculty and staff, that leaves a lot, you know, that's a lot of time for infections to get going. Sharon?
Thank you, Mimi, and can you hear me? Everyone hear me? Great. All right, thank you so much. You know, with all due respect to the discussion about numbers, you know, I just want to elevate what Thomas said, that basically I'm hearing from faculty, especially those with small children at home who cannot be vaccinated, that we are not really we're attending more to the number side and less to the general feeling among people as they move back to campus and their safety. And having a mandate or whatever you want to call it for vaccines on campus will provide that extra edge of safety. You know, someone's going to go, we have to remember this is a campus and community group. And so we're all going back to school, and so are our children. And so the combined effect of their going back to school and us being in session and many of those children being unvaccinated and parents worrying about them at home is going to cause a kind of ripple effect if we don't have something more stringent in place.
So Sharon, if there was a mandate, would that change your feelings?
It would make me more comfortable about guiding my faculty back on campus at this time. Absolutely. It would make me more comfortable in responding to my staff queries. Absolutely.
Joy?
If I can just add something to what Dr. Barzan has already said, and that is, well, first I want to just say that the system offices, they are very engaged in conversations with the chancellors about what we can and cannot do at this point. And the system office has never said that there would never be a vaccine mandate. I believe that they are, you know, currently we have been told that we don't have the authority to mandate the vaccine, but again, that could change. It could change certainly with the FDA's approval or the removal of the emergency use authorization at some point. So I just want to be clear about that. I also want to Dr. Barzan's point, we've been looking at sort of some of the vaccination rates of other campuses that have mandated it. And with the trajectory that we're on, which again, as I said earlier, those numbers are improving every day, it's very likely that we will be no different than those campuses that have in fact mandated vaccines, given the number of exemptions that are being permitted at those other campuses. So I just want to reemphasize some, you know, what Dr. Barzan's already said there.
Thank you. Joy?
So I don't know if we're ready to switch to another topic. Are we? If other people have comments about vaccine and we want to finish vaccine, I'm happy to wait.
Okay. I do see other hands. I think Seth was next, and then Neil, and then Donna. Or if you're all in the vaccine space. Seth, why don't you go ahead?
Yeah, I mean, we probably, I just have to say, I just don't approve of our reopening plan. And because what we're telling people is we can have a full reopening, we can fill up our dorms, we can fill up our classes, it's not possible to do social distancing, and we don't have to require a vaccine. And I just think those two things just don't go together. I think we can't have our cake and eat it too. I think if we're not going to require the vaccine, then we shouldn't have a full reopening with dorms at maximum capacity, classes in person, et cetera. So that's really my main position. And I'm also hearing from folks, there's so much anxiety among students, among staff, among faculty. I feel fortunate that my kids are both now old enough and are vaccinated, but all the folks out there that have kids that can't be vaccinated because they're under 12 and the university is expecting us to come in and teach in person, possibly bring the virus home to kids. I'm worried about staff interacting with students, staff in the dining halls where students will be taking off their masks and eating. And I just think we are one of the leading public universities in the world, known for our research, and we're not following the research, we're not following the science, right? I really think we're letting the anti-vaccine crowd win this conversation. I've also talked with legal folks, and I agree that the legal arguments, I think, are not really all that strong. So I know that's not going to necessarily help the situation right now, but I'm just disappointed that we're not doing the right thing. I also think we're just thinking about reopening, right? We have to think about the next year, if employers don't do the right things for their employees, if companies don't step up, which some of them are doing to require the vaccine, we're never going to get out of this pandemic, right? We're just never going to get out of it. We have what feels like a crisis with reopening next week, but this is going to go on and on and on. And it's going to take institutions stepping up and doing the right thing and saying, look, if you want to fully participate in campus life, in classes, then you have to get vaccinated. And if you don't, then don't get vaccinated, but you can't fully participate in campus life. It's the wrong message that we're sending, that people can just take a pass on the vaccine. Last thing I'll say is I've talked to a lot of people that there's a lot of vaccine hesitant people who need a nudge. Of course, there are really hardened people that may never get vaccinated. There's a lot of people that just need to be told, you need to go get it and need that nudge and a requirement.
Okay, we have some questions.
I'd like to ask Seth a quick question, and I appreciate your concern, Seth. But if there were a vaccine mandate in place and 90% of our students were vaccinated after the mandate, 85% of our faculty and 80% of our staff, would you feel safer than you do right now?
Absolutely, I would. And I think others would as well. Yeah.
So in the absence of a mandate, if we had 90% of our students, 85% of our faculty, and 80% of our staff vaccinated, and none of them had, and those individuals, that didn't have to be tested, but we were still testing those who were not vaccinated, I guess I'm just trying to understand the difference.
I think maybe there's a difference in sort of how you understand what the institution is willing to do for you and the lengths that they'll go to protect safety on campus. So it may be not a raw numbers sort of difference, but it may be a psychological difference that's important. And then also, our testing strategy is not a testing strategy that's adequate for surveillance. It's a testing strategy that's to motivate people to get vaccinated. And so that's you would have to.
Mimi, I have to disagree with that. That's not a fair assumption to make. We're doing what is there's, for example, let's talk about. I think the argument about school-age children has come up, and there is no recommendation to test school-age children on a regular cadence on a large swath that's being implemented across the state of North Carolina. We are doing something that is we're going beyond expectations by starting a testing program that does do some level of surveillance testing in our general community to like Dr. Weber said, isolate early cases as fast as possible. testing on an everyday basis is not something that has been shown to be beneficial. If we see, and this goes back to Amanda's original question that I couldn't answer because of my connectivity, we have every intent in place to adjust the testing program based off of the numbers we're seeing and based off of the volume that's coming in. And we're happy to do such. If it means that we may have to increase to twice a week, then we would do that. If it means that we may have to look at the way we're doing surveillance across the larger community, we're happy to do that. We just need to start at a point where on reentry, every unvaccinated student will be tested. And then there's some regular cadence of testing that's occurring after that. And that's what we're going to start with, but we can adjust if we need to.
Donna?
Mine is a non-vaccine question. So we can go back to Joy if you want to.
Or to Neil, is yours a vaccine question? And then I see Lamar and Ethan. Let me know in the chat if yours are vaccine questions, please.
Yes, Dr. Chapman, mine is vaccine related.
Thank you.
So from what I've been hearing in this conversation, it sounds like our institutional justification for not pushing perhaps more strongly for a vaccine mandate or engaging more intentionally in that conversation is our audit reports and information about how students, staff, and faculty are vaccinated. But from previous conversations I've had, it sounds like there is a gray area in terms of that data is an estimate at best, and our ability to fully and authentically capture the true vaccination rate of our campus community is limited. And to that point, we've also acknowledged that even individuals who are vaccinated can acquire and spread an infection, although the severity of their infection may not be enough to require hospitalization. But my question is why, as a student, I should even have to think about having any sort of symptoms of COVID during my time at the university. I recognize that myself being a fully vaccinated individual, I'm not necessarily at risk of being in the hospital, but I'm not only uncomfortable by the notion that I could potentially transmit it and asymptomatically spread it to someone who is more vulnerable, but I'm also concerned that I have to factor the fact that I could be infected into my curriculum and coursework as a pharmacy student. And so I think that's an element of the conversation that's been missing. We've been talking about what is right for our student community. And I can say unequivocally that what our graduate and professional students want is to feel safe, particularly our graduate and professional students who are teaching. And I myself don't have teaching responsibilities, but I would feel far safer knowing that my risk of having an infection is as low as possible based on institutional policy. And I don't think we're in that place right now. And so I have a lot of questions.
Thanks, Neil. Ethan?
Yeah, so over the last few months on a number of issues, I think we've heard time and time again about the importance of the shared governance structure at UNC. And I think this doesn't feel shared at all. It feels very unilateral. It is very unilateral that the system office is imposing this restriction on campuses to not be able to mandate vaccines. And I think the difference is in climate, but to me, it's also in prevention. We know vaccines are a strategy to prevent infection, even if we're testing the unvaccinated students, faculty, that only can catch cases after they happen. I think this is really an issue of, we know what tools work. UNC is very proud of having the #1 public school of public health. And I think we need to be listening to the experts who have time and time again stressed the importance of vaccine mandates for reaching that extra population that needs the nudge to go and get vaccinated. And I think we're missing a real opportunity to prevent infection and also to, like many have said before, make people feel safer. Anxiety on campus among students is very, very high coming into the fall. I've heard from so many of my peers about just how stressful it is trying to go back into a reopening that feels very similar to what we've tried in the past without a vaccine mandate in place. And I think a vaccine mandate would go very far to reduce some of that anxiety and provide more safety, more of a feeling of safety to students and faculty and staff and their families who are very much a part of our community as well.
Lamar, is your question related to vaccines before we go to Joy and Donna that are, I believe, switching topic?
It is, and it's more of a comment, and I may have a question in there. Um, I have to say, I'm disappointed for a number of reasons. For one, this is more than a 1 hour conversation. That's what I'm going to begin with that. And this is more than just a last minute conversation that we have days before the first day of class. Two is part of this conversation is really ticking me off because it is rooted in a privilege that people of my skin color do not share. And I say that because, for one, we have mandating the vaccine or requiring a vaccine. I have pushed for the vaccine for more of my peers to get vaccinated more than anyone else I know. And Chancellor Guskiewicz, I believe you're aware of that because you and I have did some joint efforts on that to get more folks vaccinated. But part of this is there's a couple of realities that are just confusing to me as student body president. I would consider myself the most connected student at this campus. And so if I'm confused on these topics, you can imagine that a lot of my peers are as well. One is with this attestation process, I just went back through and reread the campus communication and went out. And at no point did it blatantly say, you are required to upload proof of your vaccination. It said, though, that you're required to attest and that there'll be an auditing process. And what I wondered as an out-of-state student was, does the auditing process also cover South Carolina, where I'm from? Can you verify that I, as a South Carolina resident, got vaccinated in South Carolina? Does that also apply for those who got vaccinated for government-sponsored vaccination clinics through your county, through your city, or also through Walgreens and private folks, or through their normal family providers? How does the auditing process work? What is the timeline on that? These are things that, and I'm sure there probably are answers, but these are things that are really confusing for me as a student who's expected to come to campus for in-person classes next Wednesday. Not to even mention, I think Audrey put in the comment that we can expect students who do test positive or who do exhibit symptoms to miss 10 days of classes at a time. And I want to just say, and this is no slight to the faculty on this call, as a student, we have had trouble with our faculty extending us the grace and compassion that we deserve. And it may not be anyone on this call, but we have had it. I've had it personally. And even when the provost, and I've seen him on a call tell faculty, we need to have compassion. I've seen him give that directive to deans and department chairs. That does not make it a virtual reality for everyone. I bring that up because when we talk about the necessity of the vaccine, it's really important for people of my color, from the Black community, who I would argue were the most hesitant to originally get involved in the vaccine. I think it's important to understand that for students watching this call, I'm getting text now I'm on a Mac, so I'm getting the text at the top. It's really confusing what we're pushing right now, because as a student watching, one student may interpret this as there's a reason to get the vaccine at all, but I'm going to push for a vaccine mandate. That is what I'm getting text at this very moment. And what frustrates me is I understand what the system guidance is and all of this, but part of this is, if I as a student can attest that I got the vaccine without uploading proof, or that is a requirement, we need to better communicate that, but I don't think that is a requirement. I think the only requirement is that I attest that I did get vaccinated. And then I am opted out of the requirement to get tested. So I say I got vaccinated, I don't have to test. And I'm not saying that there are many of my peers who may be saying that they did get vaccinated, but they really didn't. But I don't have full trust in the system right now to tell me on day one, by next Wednesday, that all these folks, it's 90% of students that's attested, yes, I got vaccinated. They truly did get vaccinated. We were able to prove each one of these students. And that is a kind of security that I think students, faculty, and staff deserve walking into the school year. And I'm not really here to say, whether folks should be required to be vaccinated or not. All I'm here to say is that right now there is a general sense across campus of folks not being able to feel safe. And I'm just, and that one question about out-of-state students is one I've gotten a lot. Can we attest that folks who did not get tested in this state, can we, is that a part of our auditing process? And if so, does it include everyone, even through private? What does that mean? And so that is, I guess the one question I do have is, does anyone know that?
Yeah, Lamar, you raised a number of points, a number of important points. First of all, with regards to out of state, you're right. The auditing can only occur within the state of North Carolina, and so that is a practical reality. We are trying to remind everyone that it is important to be honest as part of the honor code, as part of your expectation of being a member of this community. We're asking everyone to be honest in their attestation. The attestation, we did a lot of thought about, we gave a lot of consideration to upload, and we strongly encourage everyone to upload their card. But as you also know, Lamar, that there are ample rumors, that there are bogus cards out there and that individuals can falsify a card and upload that as well. And that can take place whether or not it's simply an attestation or whether or not you actually had a vaccine mandate. That verification is not simple and not without suspicion. And so we are saying to our faculty, staff, and students, there is an expectation that you will comply, and there's an expectation that you will be honest. And we are doing our best, to audit where we can. And then if individuals during a contact tracing experience demonstrate that they have misrepresented themselves, then we will have to take appropriate action accordingly. But your point is well taken. It's not a perfect process, but we are working hard to try to get as much accuracy. But I just wanted to make the point that we would have the same concern whether we were mandating vaccinations or not.
Okay, we have other questions in the chat about social distancing in the classroom, given the infectiousness of Delta. So maybe we should bring that up before switching gears completely. Joy and Donna, I'm sorry, we will get to you, but hang on.
I can address that, Mimi. There's no physical distancing requirement indoors. And I am following on Dr. Weber's comments, about if we have a mask requirement where everyone is wearing a mask, and 90% of our population is vaccinated. I think based upon everything that Dr. Weber and Dr. Barzan and other infectious disease experts have indicated, that we believe that's a very safe environment for our community to work in and to learn in. I know that people don't necessarily like wearing a mask all day. We had that experience just yesterday at a chancellor's retreat, and all the participants in that retreat indoors wore their masks the entire 8 hours of that retreat. So I know that that's not a perfect scenario for everyone, but mask on mask with vaccinations, and Dr. Weber, please correct me if I'm wrong, is a very safe working situation.
So I would just second that. We obviously can't physical distance here in the hospital where we're providing patient care. So we're close to all our colleagues as well as our patients. And again, a mask on mask policy has worked very well. Physical distancing is important, particularly in one circumstance, which is when people are eating or drinking and you don't have your masks on. And then your primary protection, besides vaccines, of course, is physical distancing. And that's the one time that physical distancing needs to be followed. But provided people are masked, that is the critical element in preventing transmission along with vaccine.
Okay, let's go to Joy and then Donna.
I have an entirely different topic, so I don't know if, we're out of time, but I'm just interested in what we're going to do, either mitigation or prevention, whatever we're going to do about big events. It looks to me like Fall Fest is still happening Friday, and it looks to me like we have football games happening with 50,000 people. I'm just interested what the planning is for there, and are we looking at requiring vaccines or COVID testing or anything? Fall Fest, you can't do that, but I'm just curious about the mass events that are being planned. What's the thinking there?
Yep, and Sharon is seconding your question, asking about dining halls, given what Dr. Weber just said about eating. So I think it is a completely related question, Joy.
I mean, I'll just say, and can turn to Dr. Weber, Dr. Barzin, and others. These are out. Well, the dining hall situation is not obviously outdoor, but these outdoor events such as Fall Fest, football games, all sporting events, these have been happening, all over the country over the past several weeks and months with large crowds. Our experts have monitored as best they can data coming out of those, and there does not seem to be super spreader events, as we call them in the past, from these events. A lot of individuals, as I've been looking out here, are still, despite the fact that they're outside, many still wearing masks, even though they're not required. So as of right now, these events are still being planned, but we're monitoring data and we'll adapt as necessary. Dr. Weber, I don't know if you want to add anything to that. Dr. Barzin, the question about indoor eating and cafeterias, et cetera.
Well, let me just say something else about that. I'll have to tell you, I feel safer in my classroom with everybody with a mask on than I do sitting beside someone for 4 hours yelling and screaming and no mask at a football game. I mean, I guess Dr. Weber could address that. I mean, I think if I'm sitting less than a foot away from someone on each side of me, unmasked for 4 hours yelling and screaming, I have a higher likelihood of transmission than I do certainly in a classroom with everyone masked.
So I would say that, and Amir and others may want to chime in as well, but clearly masks, if everyone's masked indoors, are tremendously effective. Studies of where and transmission during COVID have demonstrated that almost all transmission is indoors in unmasked individuals, with very small amount being outdoors. But if you had to rank order them, you would say being outdoors very close to someone for a prolonged period of time would have some slight risk compared to being indoors. But of course, one always has the option of wearing a mask anytime you're outdoors, which again, in addition to vaccine, we talk about the Swiss cheese approach to illness, which is each hole in the layers of Swiss cheese has to line up. And so you now have added in 3 separate levels of protection: outdoors, which adds to dispersion and of the virus, decreases the number of UV light, which damages and destroys the virus, your mask if you choose to wear it, and vaccine. So with those 3 in place, if you in fact wore the mask outside, again, you would have a very, very tiny chance, if at all, of acquiring disease.
Hey, Dr. Weber, can I just ask for a point of clarification? The situations that you're talking about, did they look at large events such as a football game when talking about the likelihood of transmission? I just wanted a clarification.
Yeah, Richard, thank you for asking that. There have been. So there's been information from Europe about outdoor events. We had a large, I don't know if you guys know what Lollapalooza is, but that was a large event that was in Chicago about 2 weeks ago. I've not seen large outbreaks from that event, and that was descending I think upwards of 50,000 people into an outdoor venue in Chicago. And so what we're talking about there is that, yes, again, it's been noted that your lowest risk of transmission is mask and mask, regardless of indoor, outdoor, but that the transmission mostly has been in indoor environments and outdoor spaces. The risk of transmission is extremely low.
And so Amanda points out that Lollapalooza event, people were required to show proof of vaccination and a negative test. So
only 90% did. So very similar, similar rates as what we would be talking about here on campus. And again, a very kind of same format of the people that were coming in that was just, that's basically holding up a sheet of paper at someone as you're walking by a turnstile with 50,000 other people. So it's not, I think that there's a discrepancy between the stringency of the verification process there as well.
Okay. Joy, is your hand still up or shall we go to Donna? Okay, Donna.
Yes, I'm the chair of the economics department, and it seems like the focus so far has been on what I would call the extensive margin, but I'd like to ask a question about the intensive margin. So more specifically, what are the logistics going to look like this semester? And I'm thinking about some of the questions that my faculty have asked. So Dr. Bluin mentioned that there will be a need for flexibility throughout the semester from faculty, let's say, doing instruction in the classroom. And so I'm wondering what that's supposed to look like if students have to miss class. And so I don't know, I mean, if there's going to be a required, what's the word I'm looking for? Quarantine, yeah, a required quarantine, or if, but, I don't, again, somebody can speak to that, but I'm thinking more about not just missing class, but exams and what that's going to mean for faculty, especially in large lecture classes. So I've got faculty that are teaching 400 students at a time. And if students miss an exam, a scheduled exam, that's a lot of work to provide makeup exams. And so, and again, in a typical year, that has to happen. And it's obviously harder for folks that are teaching large lecture courses, but they struggled a lot over the past year in trying to deal with those kinds of situations. And so I just wonder what the flexibility that Dr. Bluin mentioned, like, what is that going to look like formally? I mean, are faculty going to be required to provide makeups? Can there be a rule in their syllabus that says if you miss it, then X percentage goes to the final, and there wouldn't be a makeup? What's that going to look like?
Yeah. So a couple points, and thank you, Donna, for that question. Certainly. We as an academy have been dealing with makeup exams forever. As a former faculty member writing exams, we never enjoyed writing those makeup exams, did we? I think we can all agree on that. But we will probably be adopting very similar approaches as we have pre-COVID-19, and that is it should be clearly stated in the syllabus, as to, how you plan to address a makeup exam. We've always had to address them in the past. You may have more than perhaps you might have had in the past, but I think as long as you're clear and upfront on the front end, then I think that will be fine. I also just want to say that we're doing an inventory right now in terms of the classrooms and also the availability for asynchronous capture of all of our lectures, so that if a student is, for whatever reason, whether it be COVID related or not, we'll be able to on demand go back and do an asynchronous recording. What we're not planning on doing is changing the format of the classroom. I think faculty have been very clear, that going to a blended learning format, or what we call HyFlex, in the fall and in the spring, is not something that faculty are going to want to do. So I think that the strategy that we're most likely to adopt is going to be trying to record all of our lectures and then make them available on demand as needed by the students. And by flexibility and compassion, and Lamar, I appreciate your comment, and I have been very insistent upon that at the dean level and at the chair level, and we have had complaints about that, Lamar. I think you have brought some of those to my attention, and we have tried to deal with all of those student concerns. But we are asking faculty, to be flexible and compassionate with our students, realizing that that we're going to have to be accommodating to the best that we can. Without necessarily changing completely our format.
Can I just flip that question a little bit too, to ask about flexibility for faculty? Because as we've pointed out, many faculty have children who cannot be vaccinated. And we already see with year-round schools that year-round schools are sending classrooms home for kids to quarantine when clusters break out in those classes or when there's an exposure. And so, that's already been happening this summer, and it's going to happen more. And so that means that you have faculty and staff that have to provide childcare for their children. They can't leave their 6-year-old at home. And if their child has been exposed to COVID, you can't get the neighborhood babysitter to walk down the street, or grandma, or whoever you might normally rely on in a backup situation. So that's something that I'm hearing a lot about right now.
Well, I think, Mimi, you bring up a great point, and it is the uncertainty, of what is going to happen. I think as of now, the feeling is that we're going to have to take those, one at a time, and sort of assess, what kind of flexibility, that individual faculty member would need. Now, certainly, even pre-COVID, we've had a number of faculty circumstances that have required chairs and deans, to be flexible in terms of how faculty, might be able to perform their teaching duties. So I don't have an ideal answer, for you with regards to covering all of the potential scenarios, but certainly I'll be talking to the deans further, and they will be talking to the chairs about what we can and perhaps cannot do.
I'm sorry, this is Chloe. Before we leave this topic, back to Donna's question, I think it would be really helpful for faculty to have some type of guidelines in terms of the suggestion that Donna made for if a student misses X amount of class, can we just allow 2 exams to count more than the 3 exams we're going to? Typically, if a student is sick and unable to do work in a class, that is not usually a reasonable expectation. It's actually something that's viewed more as a penalty because the student wasn't given the opportunity to perform on all 3 exams, right? That is not by any means, it happens all the time. I just think in this particular scenario, as we're talking about students, if they are unable to do work, then more clear guidelines beyond flexibility, or maybe if there are things that are rising to the occasion, would really help with as much consistency and flexibility that are given. I would also like to echo Mimi's comment coming from a larger department. I've already had multiple staff members who have had to readjust their schedules to be out for 2 weeks at a time because they've got small children who are in schools and someone contracts COVID and then they shut down the whole classroom, which really impacts business operations. And so I think that we're going to survive, and we'll do the best that we can, but I'm not sure that the flexibility comment is being understood all the way down to the ground, Provost Bluen, especially I think I know how you and Chancellor Guskowitz intend for it to be communicated and understood. So
I appreciate that comment, and we'll try to do a better job of maybe establishing those guidelines that you have suggested here.
I have one brief question. Following up on my question in the chat, I think Aaron Nelson, or one of the Aarons, Bockenheimer, might have provided some feedback there in the chat. I just want to clarify this. So based on the guidance we currently have, if a student group, let's say student government, for example, I have 200 people up under me in student government, hosts event off campus that's indoors, but it's off campus, we're required to mask.
That's correct.
Okay, however, if Lamar, who's about to turn 21 soon, wants to throw a party, disclaimer, I don't want to do that, just use myself as an example. I invite 35 friends to my apartment, we're not required to mask.
Off campus?
Off campus.
Off campus, you're a citizen of Chapel Hill and the state of North Carolina, and you have your individual rights.
Okay, and so the policy really only applies to registered student organizations and events that are sponsored by
I think that's the only jurisdiction that we could impose.
All right, thank you. I just want to clarify this.
Yeah, I would say, I would add, Lamar, though, that the town of Chapel Hill and Orange County are
That's right.
adjusting their requirements. And I do believe that under their new guidance or mandate, you in fact may be required to wear masks. But don't hold me to that. I think those are changing by the day. Amir, do you have an update on that?
Yeah, so just where that stands is that in indoor environments, so that's indoor places of business, it is going to be that masks are required, just like we had beforehand. The question that Lamar poses is it's like Provost Bluen had mentioned, it's very difficult for someone to be able to go into someone's home. And so when you have situations of places of living, the goal would be that we are trying to do as much as we can to limit the spread of the virus, but also should try to implore as much in terms of safety as we can. It's hard to be able to get into environments like what you're mentioning now. The town, they say that does extend into that environment, and then that would fall on the local law enforcement officials to be able to step in and make classifications or sanctions if they were violated. And the same thing with apartment complexes, et cetera. It would be into the management teams of those entities to help out in those situations.
Okay. Well,
Sorry, Mimi.
Yep.
We put the link, I just put the link in, but for clarity, independent of us having an enforcement problem, the rule is you must be masked indoors in all spaces. It does not make any exemption for your home. You can read the specifics. Now, enforcement is a challenge, and Dean Bluen is right, you have your rights, but it says including vehicles, so carpooling, et cetera. We will have an enforcement challenge, but in Orange County and Durham County, that is the rule. Lamar, if your party's in Chatham County, you have a little more flexibility. But in Orange County.
But I would argue, I would just say, Aaron, to the provost's point, the university does not have the ability to regulate. That's Orange County.
Oh, true. Yes, I mean to say that those are the rules of our region right now, rather than the university's enforcement.
And Chatham did put in a mask mandate this morning. I didn't read the details of it, but I think they're following the Orange County mandate. So we should be sort of surrounded by the same rules.
So Mimi, I'm not watching the chat. I can't tell whether there are more questions. I know that we're sort of approaching, I think we've gone over. I'm able to stick around. I stay on for about another 5 minutes before I have to run to another meeting. But I do want to just close with a few comments, but I want to see if there are any other pressing questions.
I had a final question for Amir, given the new requirement released last week for faculty and staff at a station or testing weekly if you aren't able to attest or aren't able to receive the vaccine. I want to ensure that we work with the Carolina testing program to ensure access to testing on campus for those who need it, especially for third shift employees who, while they're on campus, they need to have access to that testing program. So I just want to make sure that kind of is conveyed, and we work with Amir's team on that.
Thanks for saying that. And we will still continue to have 7 a.m. testing available on campus at the union. And I am working on contingency plans if necessary to increase the environments of testing as necessary. So happy to dive through that.
Great. Thank you, Amir.
And Amir, since we have you, and I think going back to a question that maybe Amanda had asked at the beginning of the meeting, can you confirm, my understanding is we are conducting re-entry testing for unvaccinated students.
That is correct. So once students are coming onto campus, if they're unvaccinated, they're supposed to test within 24 hours of coming into campus. So that is correct. We are doing re-entry testing. And then again, please note that that is not exclusive of those who voluntarily want to do that. And we have been seeing that, is that we have a cohort of people who are vaccinated who choose to voluntarily test because they are, for whatever reason, they would like to make sure that they're negative, whether it be to go see a family member or go on a trip. So we are still conducting those tests as well.
And just to follow up on that, those folks who are subject to that are being asked to quarantine in place until those results are known.
That's correct. That's correct.
Thank you. I do see a hand from Kate.
Hi, I'm Kate. I'm one of the graduate student representatives. I just have a few clarifying questions because this, thank you everyone for all your input and comments, but I just want to clarify before we leave the meeting. So is 2 times weekly testing for unvaccinated community members of the campus being considered at all seriously as something that will be implemented? I think a lot of graduate students would be strongly in favor of that based on what conversations I've had and what I've heard recently. My other question is, what is the official policy for students in class or instructors if they have been exposed to a positive case? Given the Delta variant, has the guidance on that changed on whether we need to isolate? Will they be notified?
So I'm happy to go through that. And actually, yes. So first part of your question, absolutely. We're considering increasing intervals of testing if necessary. And like I mentioned before, it could also include testing of the larger community. Again, we really want to try to drill down on the numbers of tests that we're doing to make sure that there is adequate access, and then also making sure that we cover the largest portion of the community before we start increasing cadences as well. The second part of what you mentioned, so isolation is so the difference between isolation and quarantine. Isolation is if you have had a positive test. There is no difference between isolation for a vaccinated or unvaccinated person at this time. If you are positive, you're still told to isolate for 10 days, no matter your vaccination status. The point that you brought up, Kate, is important for quarantining. The current recommendation and guidance from the CDC in Orange County is that if you are a close contact and you are vaccinated, you can monitor for symptoms, but you should be tested between days 3 to 5 to make sure that you did not have asymptomatic spread. If you're unvaccinated, you are supposed to quarantine. So that's the difference between vaccination and unvaccination in quarantine. Again, I have to reiterate, isolation, which is true positive, confirmed positive, does not change based off of vaccine status.
Okay, thank you. So that guidance, I'm not sure if that's clear to students and instructors. So I think that's something that I think greatly appreciate people being pointed to where these guidelines are as classes start.
Sure, yeah, and I think that the hard part about this is, again, just the kind of the speed and the frequency where these change. So that is based off of the Orange County Health Department's recommendations in conjunction with the CDC. If Orange County were to change their guidelines, we would change too. So that's why there's the general statement that is in there, which was very important, which is the quarantining and isolation recommendations will be dependent upon your vaccination status at the time. It's very hard to descriptively put every single situation out there because based off of the contact tracing and the case investigation and the vaccination status, the recommendations could be different. So my fear is that by putting information out there that is difficult to interpret just in this word of isolation and quarantining, it can really be tough to follow at times. So that's where we're relying on our isolation and quarantining teams to work on giving the recommendations to the person who that are recommended at that given time.
Okay, thank you.
So I want to bring in a question from the chat. Eliana said, do we have any off-ramps in place in the event we have a repeat of last fall? And in particular, I want to expound upon that. Do we have any concerns if we get to the point where we reach a lack of isolation spaces? Because if we're anticipating having positive cases on campus and we're bringing 30,000 students back to campus, we have to think that just 2 spaces on campus, the same number as last year, may not be sufficient. So what are the circumstances in which we see an increase or a rise on campus? What routes do we have to take?
Yeah, Bob, do you want to take that? I know that we have many more isolation quarantine beds, rooms than we had to start last fall. We had put that in place in the spring and fortunately didn't need anywhere near what we had made available, but I know we even have backup to those residence halls. Bob, can you?
So we have set aside 2 dorms, for isolation and quarantine. Depending upon whether it's an isolation need, we can maximize room space a lot more efficiently for isolation than we can for quarantine. So depending upon the relative proportion of individuals who need isolation and quarantine, the approximately 500 beds that are available to us could be used in different distributions. So I just share that with you because that's not as precise. We have made arrangements with hotels in the area, for backup space in the event that that would be needed. And so we are in a position to call upon those spaces as an option to unused dorm rooms. Remember that the majority of the people who are living off campus will be quarantining and isolating in place and not be isolated unless they seek a preference, to isolate on campus, which most students have chosen not to. We still have our campus services that will provide support for all of our students in the event that quarantine and isolation is needed. And I think that the quality of that service was really amped up tremendously in the spring in relationship to the fall of last year.
Okay, let's go to Rich, and then I know the chancellor has to go after that, so we want to hear his closing comments. So Richard, you'd get the last question today.
I just wanted to make a comment. I've been, I came into the meeting today wondering how in the world it is we don't have a mandate for the vaccine. But then after listening today, I've heard the experts tell us that, it sounds like there's not a huge difference in as far as the actual safety that's going to be put in place by having the vaccine. I think we need to remember that it was just 2 to 3 weeks ago when we were very worried about the Board of Governors trying to replace our chancellor. The chancellor has to make decisions about what is worth really fighting for. In this particular case, I just wanted to say I feel like the data that the experts have provided us has certainly put me at ease as regard to where we are currently with regard to the number of students who have been vaccinated. I have to hope that our students and faculty and staff will be honest in reporting and follow the UNC honor code. But I just wanted to make that statement.
Okay, thank you.
Richard.
Kevin,
Amy, before Kevin speaks, could I just make one comment? And it's really a follow-up on I think something that Richard said. I just want to personally thank all of the students, faculty, and staff who have attested, and hopefully have attested positively. The numbers that we are seeing are very impressive. With 93% of those of students who have attested, yes. And so it really is great, that our students have fully embraced that, and over 92% of our faculty have attested yes. So just that their participation in the attestation and their willingness to try their best to comply, assuming that they are all being honest with it, I think is worthy of note. So just thank you.
Yeah. Thanks, Bob. And I just want to echo what Bob has said, and I want to thank all of you for being here today, but also for picking up the phone and calling me, calling Bob, calling others when you have a question or concern, because I probably have heard from a third of you at one time or another over the last 4 or 5 weeks. And yes, I wish we could have convened more, earlier, but we're here today, and we'll be together again. And I hear your concerns, your questions, I think are really important to help us move forward and continue to try to answer some of those questions. I, like you, want everyone to feel as safe as possible as we think about this return to campus. And your voices and certainly the opinions of our experts who have joined us today. And I want to thank them again. And they're with us every day, working through this for all that you've done. And it's one of the reasons why we increased our requirements or ramped up those requirements in the campus message last Friday to require that attestation or testing for all of our campus community members. And, I hear what Lamar is saying and concerned about how we can really verify so that everybody can feel safe, that those who have attested to vaccination have in fact been vaccinated. I want to give our students the benefit of the doubt. We have incredible students here, and I'm going to, I know there are some concerns and different motives that they may have in terms of why they would potentially falsify something. I just don't believe we're going to see that to be the case. And right now, with the audits that have taken place, we're close to 100% verification accuracy on this, and I think we'll continue to see that. We do have to work through those. Lamar has indicated how we can do a better job of verifying out-of-state students' records, and we're working on a plan for that. So I just want to again thank all of you. I want to also, again, as Bob and I have done before, publicly state that we support a vaccine mandate, and I'm going to continue to advocate where I can, when I can, based on the guidance and the advice that our public health and infectious disease experts have given us about why, in fact, a mandate and the vaccine itself, most importantly, works and how it can help us move through this semester safely and provide as close to a normal experience here on campus as possible. So I'm going to stop there and jump off. I just want to thank you all. I want to thank Mimi and Lamar and Katie for your leadership of the committee, Chris McClure for helping to convene the meeting. And we will get back to you with some answers to questions that you've asked here, and I'm sure there will be more to come.
All right, thank you, Chancellor, and thank you both to you and to Provost Blouin for your continued advocacy of a mandate. I think that is a strong sentiment across all sectors that